It is now my pleasure to introduce Dr. Quaid Saeed, a distinguished public health specialist renowned for his extensive expertise in infectious disease control. Dr. Saeed, we are honored to have you lead us in this conversation. Over to you.
Thank you. Assalamu alaikum. Good afternoon, everybody. I'm honored to moderate this panel discussion, and the topic is Partnering for Success, Unified Efforts for Hepatitis C Elimination in Pakistan. I have excellent group of experts from Pakistan and outside. Let me introduce them one by one. First, I would like to invite Dr. Saeed Hamid. He is Director of the Clinical Trials Unit at Aga Khan University Hospital. Dr. Saeed Hamid. Next, we have Dr. Fuma Qureshi, well known in Pakistan, a public health specialist, a focal person for hepatitis control and elimination in Pakistan, and a long-time supporter of hepatitis program in Pakistan. I will now invite Mr. Nico Michel. He's the life cycle leader of infectious diseases in molecular lab in Switzerland. Please have a seat. We have Ms. Liliane Kanan. She's the country manager at Roche, Egypt. Liliane. Now I invite Mr. Abdul Qayyum Khan, who is the country manager of Roche Diagnostic. We all know Mr. Abdul Qayyum for a long time. Finally, we have Dr. Mariam Sarfaraz. She's the project director of National HCV Elimination in Ministry of National Health Services Regulation and Coordination. Thank you very much. I think we have an excellent group of experts on the stage, and let's start our discussion with our hepatitis elimination program in Pakistan. Let me talk to Dr. Mariam Sarfaraz, because she is the focal point in National Ministry of Health on the PC1 proposal that we have in Pakistan. Where do we stand in terms of where we are in the PC1? We know that it is approved. We know it is approved by the Prime Minister of Pakistan. The money is already there. But what is the next stage in terms of human resource, in terms of procurements that are going to happen? That's my question number one. But there is another question. What are the main interventions? Do we have prevention, screening, diagnosis, treatment as part of this project proposal?
Thank you very much, Dr. Quaid, and thank you all. Thank you, Roche, for inviting me to give my point of view from the government's perspective, from the ministry's perspective. So, like you said, yes, the PC1 is already approved. The money has been earmarked or fixed for it, and but since, like Dr. Saeed said in the beginning, that we are investing our own money first. It is not donor funded or pledges from external partners or anyone. So we have to go by certain very strict guidelines and rules to ensure that the money which is coming from the taxpayers, from the national pool of finances, it is spent at the right place with minimum of wastage. So to do that, we have to complete certain steps. First of them is a comprehensive implementation plan with the provinces, whereby we are discussing with them as to what is the actual burden in their districts, which are the ones which are high burden. So like, I think Khalid, if I'm not getting his name wrong, he mentioned about starting by regions. So for us, the phasing is by burden. So the first phase would be with high burden districts, and then we move on to the next and so on and so forth till we have covered or completed maximum of the population on the road towards elimination. So the first step of implementation planning is a discussion with the provinces to identify the districts with the highest burden, to identify the exact population which is 12 years and above, who is eligible for screening and who has to be screened and put through a treatment program if they turn out positive. So we have completed that for Islamabad, we have completed that for Khyber Pakhtunkhwa, and our next stops are going to be Sindh, Balochistan, and then AJK and Gilgit-Baltistan as well. So that's the first thing we have to do. The second, in terms of where we are in terms of the procurement, we're working on developing the bidding documents and developing those lists of commodities which we would need for the different components within the PC1, and that would be the response to your to your second question as well. The key components within the PC1 are, number one, prevention, yes, and it's not just prevention through messages or printed messages or something like that, but it would be, we are hoping to develop a mass media campaign for all print and visual medias to make the population aware of what this is, to increase awareness about the program itself so that people can come and get themselves screened instead of us having to do more of an outreach. We are hoping to have more footfall at the health facilities so that people are coming and getting themselves screened actively over there. And there would also be a component in it for the healthcare providers to make them aware and informed about injection safety, about blood transfusion and the hazards of not using screened blood for transfusions. Of course, that lies within the larger parameter, but the component within the PC1 is awareness. The second part is screening. So screening is something which the federal government has committed to do 100% screening of the eligible population. And in that context, we would be purchasing the rapid screening kits for the entire eligible population with the provincial components as well. The other part, after if somebody turns out positive on the rapid screening test, the second part of it is diagnostics to make sure that they actually have hepatitis C, and that's the PCR. A portion of it would be supported by the federal government and the rest would be supported by the provincial governments, and 50% of the treatment costs for hepatitis C will be borne by the federal government PC1. Now, for all of these, we are, like I said, we are developing an implementation plan with the provinces so that we understand really their high burden districts. We understand what are their commodity purchase situations and how much of a stock of screening, PCR and medicines they have with them. And the last part to the PC1 is the human resources. So since this is a very heavy procurement based PC1, so we're just having a small project management unit at the federal level to oversee the procurement, logistics, and monitoring and evaluation. And in that context, we have already we have advertised and are now in the process of shortlisting the applicants which have come for the different positions within the project management unit, and these include management specialists, procurement specialists, and the finance specialists, so that we can do a good financial phasing as well. So many of you who have worked in the government would know that the PC1 process is that every year there is an allocation, and for those allocations we need to give them a financial phasing plan. So that's the reason we need a finance manager as well to kind of tell us as to what is the fund we would need in the first year, and the second and third, so that we get those surety of allocations and are able to spend them in a wise manner. I hope I have answered all your questions, but if I've missed out, please let me know.
Thank you very much. I think that was a very detailed response, and you elaborated in detail the different components of PC1 and where you stand at the moment in terms of implementation of that PC1. But basically, this PC1 is focusing on screening and treatment. You said about prevention, which is actually awareness of the masses on hepatitis and its treatment and its diagnosis. But the prevention part is not being directly dealt through this PC1.
Absolutely right. That is not being dealt through it. And that's why I said the prevention is only communications and not injection safety or blood transfusion safety programs.
Thank you very much.